Hello, everyone. This is a paper that was published earlier this month and basically goes over breakthrough infections. So, basically, looking at are breakthrough COVID infections somehow different than non-breakthrough infections? So, the people that get vaccinated and then get an infection, is their disease somehow different than people who don't get vaccinated and get an infection? Now, we know that vaccines are protective. Early on, they were like 94% protective, but now they're, with Delta, it's probably like 70 to 80% protective. So now there's a higher rate of breakthrough. So there are more people who are getting the disease even though they've been vaccinated. Now, is there something different about those people? The most interesting part about this paper is what it says about long COVID, I think. All right, so let's go over this paper. The paper looks at basically a large group of people that used an app. They had an app that, okay, right here. So between December 2020 and July 2021, 1,240,009 COVID symptom study app users reported a first vaccine dose. So basically they had this app that people had on their phone, and they could just um, put down their symptoms, and if they got their symptoms, they were suggested by their app to get COVID tested. And they would get COVID tested, and they would report whether or not they were COVID positive or negative, and whether or not they got vaccinated. So they had a huge number of people. Okay, so here it is. They had nearly 4.5 million unique participants providing data by self-report or by proxy report. Proxy report means someone else was reporting for them. So yeah, this is a lot of people, 4.5 million people. Then they measured baseline demographic information: age, sex, ethnicity, weight, height, healthcare worker status, location, comorbidities, that kind of. So they got a bunch of stuff, and then participants were encouraged to self-report any of 32 pre-specified symptoms daily. So patients on the app were supposed to say yes or no to a bunch of symptoms daily, and then if they got a bunch of symptoms, the app would tell them, you might have COVID, you should go get tested. And then they would get tested, and then they would report whether the test was positive or negative, and whether or not they were when they got vaccinated. So they had a huge data set. All right, so let's look at the information. So then what they did is they compared people who had their first vaccine and their second vaccine, and whether or not they got COVID, and how their COVID um, symptoms were different than from people that were not vaccinated. So this is just demographic information showing that everyone was pretty similar across the group. Most of these patients had the Pfizer um, vaccine, and then another group had the AstraZeneca vaccine, and then a few had the Moderna vaccine. So mostly it was AstraZeneca and Pfizer. And this is their comorbidities that they reported. All right, so let's get to the good stuff though. All right, so that's just regular data about the people that were, okay, this is the important thing. Okay, the blue represents people that are, quote, fully vaccinated, so they've had 2 doses. And then the orange or red represents after their first dose. And then this is what's called an odds ratio. And that means if it's 1, it's exactly the same as controls. That means people that weren't vaccinated. If it's 2, that means it's twice as often as people in the control, twice as often as the unvaccinated people. If it's less than 1, it means it's less likely than in the vaccinated people. So what it shows here is, and this is they separate out in younger adults and older adults, but mainly we'll just look at the total all comers. So hospitalization risk is much lower. The odds ratio looks like it's about 0.25. So you're like 75% less likely to go to the hospital if you've been vaccinated. And then you're also less likely to have more than 5 symptoms. And then here's the long COVID thing. Symptoms lasting more than a month. You are half as likely, if you have both vaccines, to have long COVID than people that are unvaccinated. So this, I think, is the most important finding in this paper. And then asymptomatic disease, you're more likely to have asymptomatic disease if you're vaccinated. All right. And then these are the symptoms that you get. So The vaccine did not protect you against cough, sneezing, brain fog, or shortness of breath or chest pain as much. It protected you really well against like fever, loss of sense of smell, sore throat, diarrhea, those kinds of things. Okay, so discussion. This is where they talk about what they feel like their results showed. So they said, we found the odds of having symptoms for 28 days or more after post-vaccination infection, or approximately half after having 2 vaccines. So you're half as likely to have, quote, long COVID by their definition, which is more than 28 days. This result suggests that the risk of long COVID is reduced in individuals who have received double vaccination when additionally considering the already documented risk of infection overall. So what they're saying there is that, number one, the vaccine protects you from getting COVID at all. So obviously you can't get long COVID if you don't have regular COVID, if you never get infected. And then two, even if you get infected, you're half as likely to have long COVID. So that's a very important finding of this paper. Then they basically talk about their limitations. So our study has some limitations. Although we use data from a large population, 4.5 million, the sample contained disproportionately more women than men and underrepresented area individuals in more deprived areas. This makes sense because it's not a random sample of people, right? It's only the people who chose to install this app on their phone. And evidently more women were interested in installing this app and using it, and people who are wealthier who have access to smartphones are more likely to, and have time to do this stuff, are more likely to use it. So there is a selection bias in this thing, and also it's all self-reported data. That means none of this data is really confirmed. We're just trusting the users of the app to report accurate data. Now, there's some people who are probably just putting in information that's not good. There's probably a small number, but you figure out of 4.5 million people, most of the people were using the app as intended and doing what the app asked them to do. Now, if like people were just purposely putting in bad information, there's no way to know in this study whether they were just putting in bad information. Our study has strengths. Previous data from from this group have concurred well with population-based studies. So what they're saying is their data, the other data they've collected, matches up well with other studies, which suggests that people are not just putting in bad information. And then it allows them to collect daily prospective information, so they have a lot of fidelity. Okay, so I think that pretty much sums up this paper, the important parts of it. The important parts are basically that one graph, this graph right here, where it shows hospitalization risk is way down, especially in older adults, and these are the people we really need to protect. And then it protects you from long COVID, and you're more likely to have asymptomatic infection. That kind of makes sense because you're going to have less severe infection if you have it after the vaccine, because your immune system's a little bit primed, so you're more likely to have asymptomatic and less milder disease, which is kind of the point of the vaccine. All right, so I will link this paper below. I would encourage you to go read it for yourself if it interests you, but I thought this was the most interesting finding, that it does protect you from long COVID.